Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Hypertension in pregnancy. Hypertension in pregnancy, the drugs which are safely given in pregnancy. Drugs which are safely given in pregnancy are, we have drugs like methyl dopa is actually the drug of choice in pregnancy. Then we have clonidine can be given in pregnancy. Beta blockers, especially labetalol, are given in pregnancy. Then we have dihydropyridine type of calcium channel blockers can be given. Hydralazine and also prazosin or phentolamine. So these are the different drugs which are safer in pregnancy. So drugs like methyl-dopa, clonidine, beta blockers like labetalol, dihydropyridine type of calcium channel blockers, hydralazine, prazosin, and phentolamine are safer in pregnancy. Whereas the drugs which are contraindicated in pregnancy are acetylcholinesterase inhibitors, ARBs are contraindicated in pregnancy. Renin inhibitors and also nitroprusside are contraindicated in pregnancy. So overall, if you were asked what is the drug of choice in pregnancy, drug of choice of hypertension in pregnancy is actually alpha methyl dopa. And what is the drug of choice for hypertensive emergency in pregnancy? The drug of choice for hypertensive emergency in pregnancy is actually labetalol, or hydralazine is drug of choice for hypertensive emergency in pregnancy.
thank you and thank you for watching.